Well, cases of COVID continue to decrease, allowing another health issue to get the attention it deserves. It's multisystem inflammatory syndrome, or MISC.
In this morning's STL Moms Report, Fox 2's Molly Rose is talking with a doctor about what parents need to know. I've not heard of this one, Molly.
Yeah, I haven't either, Randy. So this morning we're going to be learning more about MISC from Dr. Bradley Ornstein. He's a Mercy Kids Pediatric Infectious Disease and Rheumatology doctor. Doctor, thank you for being with us. What is this MISC and how are kids getting it?
Yeah, so it's a really interesting disorder that we're still learning more about now. But a lot of kids, thankfully, don't get very sick when they get COVID. Some do, but most don't. But some children, even after they've recovered from COVID, they can develop this bizarre inflammatory disorder where their immune system just turns back on and can actually get them really ill.
And what are some of the first signs and symptoms that parents need to be looking out for that their child might have this?
Yeah, so the primary thing is going to be fever, and that can be fever that can last even for weeks sometimes. But then other common symptoms include red eyes, rashes, they can get joint aches and pains. Gut issues can be pretty common too. A lot of stomach pain, vomiting, and diarrhea are quite common.
We know with COVID, there's some kids that may not have any symptoms at all. Is this also something that kids could have this and not have symptoms, or would you definitely know if your child was dealing with it?
No, you would definitely know, but I think one of the interesting things is their COVID infection, you might not know about that. They could be completely asymptomatic from COVID and still, usually within 2 to 6 weeks after they recover from their COVID infection, again, sometimes you don't even know they had it, their immune system just turns on and they can get quite ill. I think one of the most concerning things that can happen with it is that it can cause their heart to get very inflamed, and it can end them in the ICU at times.
So this definitely sounds like something that can be pretty serious. You need to seek treatment. What are the treatments for this, and how does a parent know when they go to the doctor or the ER?
Yeah, so, the treatments are very effective, thankfully. Kids can get very sick, but they seem to recover almost, across the board with appropriate treatment. So we actually give the medicines something called intravenous immunoglobulin, and often steroids are used too. We actually have to kind of calm their immune system down. But the warning signs would be fever that's persisting for several days without another explanation. And the real concerning signs would be if they're starting to get short of breath, complaining of a lot of chest pain, because those could be signs that their heart's starting to get involved.
Doctor, as we wrap up here, any age of kids that you are seeing this in most often?
It's most common in adolescents, actually, but we've seen it in newborns even, whose moms had COVID in the late stages of pregnancy, all the way up to late teenagers. It's very rare in adults, but is happening there. I think the one thing I'd like to say is COVID vaccination has actually been shown to reduce the risk of developing this MISC complication by over 90%. So just another good reason to get your kids vaccinated when eligible.
Dr. Ornstein, thank you so much for all of the information.